Hey guys, welcome to Podiatry Practice Mastery. Don here. You guys have to listen to my rants again. And the latest thing that's been on my mind is I'm reading this book called Subscribed. And, everything these days is a subscription model. I talked a couple of weeks ago about how even like Panera Bread, they have this subscription thing where you can get coffee for $8 a month, and you just keep kind of going back there and they're going to get you on all the other things that they offer. I find that within our industry, it's not too common. There's really not many things that we are having people come back for a consumable. But I've been kind of brainstorming some of the pain points in my practice and kind of looking at some other practices. So for dentists, of course, they have the every 6-month checkup type of a thing, which works well for them. So I was thinking of a couple of things, okay? I know we have like the diabetic shoes. If you like that, that would be something. We have the routine care if you wanted to do that. But one of the pain points I find in my practice is orthotics. And I was thinking, is there a way that we could, within our profession, do an orthotic subscription? So let's talk about this a little bit here. So some of the what's currently working for orthotics maybe is, you buy them or you order them for $60 up to $100, and then the price is from, whatever you charge. We charge $550 for ours, and that's fine. And then sometimes certain patients get a second pair, but then that's about it. They might get another pair in 5 or 10 years. So let's kind of change this paradigm, right? And then the orthotic company, they then insure it. You have a pediatric outgrowth program with orthotics, and we're very good at making orthotics. Now, but the big drawback is if insurance doesn't cover them, like here in Massachusetts, many times insurance doesn't cover it for us. And, the price is an issue, and certainly we can get over that price. But I'm not talking about getting over price. What I'm talking about is, can we turn this into a subscription type of a model? Okay? So what would be the thought? Well, could we figure out a price point and offer it to our patients? For example, and I don't know who would do this. I don't know if this would be like a leasing company that would set this up, or if we would just self-do this in our office. But let's say every patient that wanted an orthotic, you would give them the option, okay, Mrs. Jones, you can get an orthotic for $550, or we can do that, it's like $10 a month for like 3 years or something like that. So something that's very easy. So $10 a month, that's $120, so $360. Now I know that's less than the $550, okay? I understand that. So we're going to give them a substantial discount. Okay, we're not charging them more, we're actually charging them less, okay? But the idea is that you'll say then in 3 years, you'll get a second pair. You'll get a new pair of orthotics every 3 years, okay? So that's the whole thought. And then in that, whatever that $10 or $15, then you add other things. This is kind of how they do things. So what are the other things that we could add? Well, we could add loss protection. You could add breakage protection. You could add, for kids, outgrowth protection. And then you could start adding other things. You could say, we were going to give you also access to our VIP backline to ask any questions. These are things that we are already doing, but we're just kind of packaging them in a different way, okay? And then along with that, what you would do is you could say, well, then this would, let's just throw this into like the marketing aspect. Then you would do, once they get it, then they would be part of your, let's just call it an orthotic club, okay? And then in that orthotic club, they would get a series of emails, right? So you would have your yearly follow-up to look at your orthotics. You would have a series of emails that would go out to them, and you would give them tips, everything regarding orthotics. You could talk about the best shoes. You could talk about how to get used to them. You could talk about what are the common problems. You could talk about, anything that you want to talk about orthotics or biomechanics or anything like that. So this would be part of your orthotic club that they would be part of. And then in 3 years, it would trigger getting them a new pair of orthotics. And then every 3 years after that, it would be a new pair. So what we're really banking on is having these repeat orthotics, or 5 years, or whatever you choose. And then what they can do, though, is after the 3-year mark, they could also cancel. Like anything that's a subscription, right? They could They could cancel after 3 years and just not keep going, but if they do, they would automatically get a kind of a second pair, and you could do a new scan if you thought it was necessary. Another thing you could do is if patients want a second pair, let's say they want a dress pair, or they want something for their sports or for their workout, you could include that as well for a little bit more. So instead of $10, it would be $15 a month or something like that, so they can get a second pair, and then the price could go down, or whoever. But there's a lot of different ways of doing it, but I think the orthotic subscription model would work for us within podiatry. Now, that's the benefits. What are the drawbacks? Well, the drawbacks, I think your money would substantially go down. So if you're making, $20, $30, $40, $60,000 in a year on orthotics, that amount will substantially go down because you're only getting $10 a month. Okay, so that's one of the drawbacks. The other drawback is who is going to do all of this kind of collecting of money. One thought is you could use an outside, this could be an outside business that could be developed, and basically us as the doctors, we could give the two options. This maybe even is an option for an orthotic company. You would give the two options. You could say, you could pay $550, or you could also do this reduced amount, $10 a month, and the orthotic company, they would just give you the money up front, right? So they would just give you the money up front, and then let's say $550, so you wouldn't have that great reduction in cash flow. So if you wanted to do it yourself, you could. If not, you could almost use the orthotic company as the financing company to do this. So they would just pay you maybe a little bit less, or even the same amount that you're normally getting, and it would be a win-win for everyone. And they could use like a financing company to help them. That's one of the drawbacks I see, is how we're going to get paid if that's going to have a great reduction. Or now, will it be easier to do orthotics? Are patients going to be more inclined to getting a custom device this way? Now we're going to be able to do a ton more orthotics. That's another option. So if patients see, instead of dropping $550, they're going to drop only $10. That's a much better case in point. Okay, and then there's also what happens if they don't like them? What happens if you have to return it? And what happens, all these types of things if they're not pleased, or if there's modifications, or things like that. These are all the typical things that we have. Or if they want refunds, what are you going to refund them? Like $20, even though the orthotic cost you $60 or up to $100. But those are things that you could just look at your numbers, and the orthotic company or whoever's financing this would have to see what are the options. Anyway, that's my idea for an orthotic subscription model. Let me know what you think. If it's crazy, if it's a good idea, let me know. Please join our membership for Podiatry Practice Mastery. On there, I did include a nice video on orthotics. There's a new section on orthotics that I put up there recently. I'd like you to look at that, and I'd like to know your feedback. Email me at don@Podiatry Practice Mastery. We're putting together a few ideas for the future, such as like some, boot camps. I'm not sure what I'm going to call it yet, but just some ways for us to get a little bit more accountability amongst each other, okay, and helping people to take action. Okay, have a great day, guys. Okay, bye-bye.